Hello, my name is Rachel Jean Dennis, and today I will be talking about Chlamydia trachomatis. What is chlamydia? Chlamydia is a well-known sexually transmitted disease, an STD. The bacterium Chlamydia trachomatis is responsible for this disease and spread through vaginal, oral, or anal sexual intercourse. Some people might not be aware they have it because most individuals are asymptomatic or show no symptoms. The portal of entry and transmission method. So the portal of entry for C. trachomatis is through mucous membranes, preferably the genitourinary tract, conjunctiva, and the oropharynx. The method of transmission is through direct person-to-person contact transmission of the genitals or bodily fluids. Symptoms. C. trachomatis can infect the throat, eyes, or rectum. However, some cases may be asymptomatic or show no symptoms. However, in a symptomatic case, symptoms may vary depending on the location. If the eye is infected, which is in this case conjunctivitis, pink eye, symptoms may include having a red inner eyelid, scratchy eyes, tearing, eye discharge that forms a crest during the night, and inflamed or swollen conjunctiva. If the genital tract is infected, symptoms may include testicular pain, painful urination, vaginal bleeding between intervals prior to and after sexual intercourse, vaginal discharge, and discharge from the penis. Diagnostic tests and treatment. So one diagnostic test is the nucleic acid amplification test, or NAAT. This test could test for infection at genital or conjunctiva sites where the disease usually spreads. So, a urine test or a sample of vaginal, urethral, or alternative secretions are needed, and the NAAT will test for signs of the bacterium Chlamydia trachomatis. Treatment and prevention. Treatment for Chlamydia trachomatis involves antibiotics. A one-time dosage may be provided, or medication could be taken for a week. Often, the infection clears 1 to 2 weeks after taking the antibiotic medication, but a patient can still spread the infection at first. For prevention, a patient should avoid sexual activity from the start of treatment until the end, where all the symptoms have gone. Sexual partners or significant others within the last 60 days should also get checked and given treatment, even if they are asymptomatic. So this picture over here shows a typical NAAT test that can be taken. This includes the instructions, the pipette, specimen bag, urine cup, prepaid return envelope, a kit activation card, and a urine tube. This can be taken at home and then sent via mail to a clinic. Prevalent geographic regions and frequency of infection. Millions of people all over the world contract new chlamydia and alternative STD infections each year. This data chart over here, this graph, is a global progress report from WHO, World Health Organization, from 2021. It shows 374 million new infections of 4 of the most common infections, including chlamydia, gonorrhea, syphilis, and trichomoniasis. Chlamydia accounted for 129 million cases globally. Interesting facts. Chlamydia is known as an underreported infection. Although it is common, many people don't realize they have it. The number of reported cases is significantly lower than the accurate estimated incidence. Databases only refer to reported and collected data. A lot of cases go unreported, especially since most cases of chlamydia are asymptomatic. Young sexually active women are more vulnerable. Women between the ages of 15 and 24 are more likely to be newly infected with chlamydia. However, anyone who is sexually active, either female or male, can be infected. If untreated, chlamydia infection can have long-term health consequences, especially for women. For women, if untreated, the long-term effects of a chlamydia infection may lead to pelvic inflammatory disease, scarring in the reproductive tract that generates infertility, and a greater risk of ectopic pregnancy.